think there will be a surge, but it'll probably be a mixture of COVID and flu, and I would have concern about the winter. Definitely that a lot of patients will come into hospital with respiratory illness, with flu and with COVID symptoms, so we have to isolate those patients, even suspected. So in that effect you will have a surge in the Midwest around it. Overall, will there be a surge? Well, it remains to be seen. If the public follow the rules that's been put out, and they have been very good, we might have really good hope of getting through this, but it remains to be seen. I think we're in a better place, definitely, because we have the bed stock coming online for us. The 6-bed block was always being built, so it was pre-COVID, so we're very lucky because the single room facility that'll be ready at the end of October. We can move into it as is then. We also have a 24-bed block going up at UHL that'll be ready in August, and we have a 14-bed block that'll be ready at the end of July. So that brings up our bed stock as single room facilities. You may not realise in the Midwest we have the best critical care unit in the country, all single room isolation facilities, so that is a testament to the Midwest, which is fantastic. So it's keeping our critical care patients very safe and our staff very safe. Will we have a busy winter? Yes, we will. The public did do what they were asked. You will see our trolley numbers dropped when COVID hit, and what we have to do is urge the public again, if they have symptoms, that they stay at home, that they isolate and that they ring their GP. The ED is not the place to come initially. If you're very sick, of course, you should come into ED. So we are seeing a bit of that at the moment. There is a surge in the last few days across the Midwest and the South, actually. And we just urge people to stay at home, isolate and ring your GP first.
Are you concerned about that surge at the ED?
I am, because our ED, the way we worked it out as an executive team, is that we opened the ED as a COVID unit. So if you come into ED in Limerick now, you are actually streamed. If you have any suspicious symptoms, you'll be kept in the emergency department. If you have a surgical issue, you now go to the SAU, Surgical Assessment Unit. Medical issue to the Medical Assessment Unit. So we're streaming all the patients out of ED. And we have to have a very close eye on trolleys, and we don't have patients on trolleys on corridor. It's okay if they're in a room on their own on a trolley. It is not okay if they're on a corridor, so we're monitoring that very carefully. Yeah, there's a lot to learn from COVID. Like, there's some very positive things that have changed in the hospital, and I think the streaming has helped somewhat with the patients waiting on trolleys. So it does mean that I had to staff the medical assessment unit differently and the surgical assessment unit, and they're very busy. The GPs rely on those units for access as well. So at the moment we're staffing them up more, and I think I'll keep them running for a good year.